8:33, we want to bring you some medical coverage on Eyewitness News this morning. Summer season just about upon us, and it's a great time, of course, to get out and enjoy your time with friends and family outside. But you know, the time between Memorial Day and Labor Day is also known as the most dangerous time of year. And joining me on the show this morning is Dr. Stephanie Leuckel from the University Surgical Associates. You are a trauma surgeon, correct?
Correct.
All right, so let's talk about vacation season in Rhode Island. We're already seeing people start to take their vacations even before school is out, and it's a busy season. So tell us about some of the things that you experience this time of year.
So trauma is always a busy service. Certainly in Rhode Island there's tons of things to do, but in the summertime we certainly see probably more motorcycle collisions. We see more of everything, but certainly motorcycles double at this time of year, and it's a dangerous, I know it's fun, but it's a dangerous piece of machinery. We just advocate that people try to wear their helmets because people are more likely to die if they don't have a helmet. Certainly more likely to be injured.
Yeah, you know, we're talking about helmets. There are some myths out there about helmets and helmet safety. Can you tell us about some of those?
Sure. I think the first thing is people think, I don't need a helmet, I'm a really good driver. But it's always not the actual rider on the bike, it's the people around you. So if you were hit, you want to have that helmet on. People also seem to think that by adding the helmet, they add more weight and stress to the neck. So if they were to be hit, but that's actually not true. The helmet protects the head and the neck from that impact. So wear your helmets, please. And
make sure it's the proper size and fit as well. That's very important. All right, what are some of the other injuries you see, you know, related to auto accidents or even just everyday summertime activities that people are involved in that can cause trauma?
Yeah, I think certainly we see more car accidents, just more young people on the road, school's out, a little more distracted driving, texting, things like that. So, and people are a little bit more excited. They're driving to vacation as opposed to driving to work. So more distraction, maybe less seatbelts. So we try to wear your seatbelt. And of course, people are going to be out. They're going to be at the beach. They're going to be at barbecues, maybe having a few drinks. And you just need to have a designated driver and try not to get behind the wheel or on the motorcycle without protection.
And on a more even serious note, as we were talking about the terror attack in Orlando, Florida, and the trauma response that was conducted at the hospitals and EMTs down in that part of Florida at the time, what sort of training have you and other USA trauma surgeons done to respond to a possible scenario, God forbid, it happen in our area?
Absolutely, absolutely. We're certainly trained. My heart goes out to the victims of that tragedy, as well as to the healthcare professionals who took care of those victims. We're all trained in active shooter training. I can't say that the trauma surgeons are any more prepared for an active shooter, but we certainly are prepared to take care of those patients. So we're trained in emergency preparedness to make sure that we're able to handle maybe more than our average patient load. And I think what's most important is that we're always available. We all live within 1 hour of the hospital, and if somebody gets into trouble, they pick up their phone and they call one of their partners, and we're there to help with backup.
And I think there was a similar scenario in Orlando in that there was an initial response, but then there was a second wave of people brought in, so you really needed that collaboration among doctors to make sure they had enough staff to handle it. So. All right, well, we appreciate you joining us with your perspective, and we're going to let our viewers know if you want to see the interview in its entirety, maybe gain some more perspective on some of the topics we addressed, you can head to our website, WPRI.com.